Hello, and welcome to a brief discussion on fat pads. So this lecture will discuss the importance of wrist fat pads, and then in the next unit, we'll discuss the fat pads in the elbow. So let's get started. First, when I use the term fat pad, that is interchangeable with fat stripe. So clinically, you'll hear the term fat pad more common, so that's why I use that term. So when we're x-raying extremities, we are, of course, looking at the bones, and the physicians are assessing the bones for any trauma to the bone. But we're also looking at the soft tissue structures. And within the joint capsule, there are these little accumulations of fat called fat pads, or fat bands, or fat stripes. And those are important because if there is an injury to that joint, it can cause fluid to accumulate in the joint, which we call a joint effusion, and that accumulating fluid can actually displace a fat pad. And sometimes that displaced fat pad is the only indication that there's been an injury to that joint. Sometimes the bones can look perfectly normal, but again, the accumulation of fluid indicates there's been an injury. So there are a couple fat pads that we're going to look at in the wrist, but real quickly, I just want you to know that the fat pads are inside of the joint, but they are outside of the synovial sac or the synovial capsule, okay? Again, that's important because any changes that occur within that joint can alter the position and the shape of those fat pads. All right, the fat pads are radiolucent, which means that they're only slightly different in tissue density, which makes them really difficult to visualize on radiographs. So they don't really show up as radio-opaque structures like the bones. That's really important for us to realize because we have to make sure we're not over or underexposing our joints with, specifically our techniques, our KVP and our mass. We want to make sure we have optimum exposure to visualize all of the soft tissue structures. Okay, so let's talk about these fat pads in the wrist. There are two that I want you to be familiar with. First is called the scaphoid fat pad, and that is indicated by the letter A on your PA and your oblique radiographs. So it's an elongated, slightly convex fat pad, and it is located, this isn't important, you don't have to write this down, but it's located in between a ligament and some tendons, and it's just lateral to your scaphoid. So remember, this is a PA projection of the wrist, which means this is the thumb, this is the pinky. So this is lateral, and this is medial, because remember, we always have to consider things in terms of anatomical position. Your scaphoid is this carpal bone right here. So it is a lateral carpal bone, and its fat pad is just a little more lateral, again, in between tendons and ligaments. So again, I just want to reiterate, if that fat pad is absent or displaced, that could be an indication that there's an injury to that joint. Okay, and sometimes it could be a fracture to a bone, but it's so subtle we can't see it other than the displaced fat pad. Sometimes the bones might be fine, but there is a strain on that joint. The other fat pad I want you to be familiar with is called the pronator fat pad, and that is indicated by letter B here on your lateral wrist. We only typically visualize this in a lateral projection because it sits anterior to the radius, and so it would be hidden certainly in your PA or your oblique projections. Again, subtle fractures of the radius can be indicated by displacement of this pronator fat pad. So, to summarize and in conclusion, please be familiar with the names of the two fat pads in the wrist and their locations. Please also understand that displacement of those fat pads can indicate trauma to that joint, which is why optimal techniques are so important, that we don't overexpose that little radiolucent structure. If you have any questions about fat pads, please let me know. Thank you.